Hello, everyone, and welcome back to the Healthcare Marketing Executive. My name's Saul Marquez, and today I have the privilege of hosting an awesome leader in marketing. Her name is Kayla Weeks. She is the Vice President of Marketing and Communications at Repario, where they're doing some pretty fascinating work in the lab space. I'm going to let her tell that story, but also tell her story as a marketer today and things that she and her team are up to really make an impact with some of the life-changing work that they're doing at the company. So Kayla, such a pleasure to have you on the podcast.
Hey, Saul, it's really good to join you as me. I feel like usually we're working together because I'm pitching you one of the CEOs that I'm building a brand for. And I love the evolution. You and I have talked a little bit in the background about how the builders behind the brand don't typically get as much face time.
Yes.
But yeah, so I'm really excited. Thanks for having me. And I'm currently the VP of Marketing and Communications at Repario Health. We are in the at-home diagnostic space. So we have a solution where we actually bring a preventive healthcare experience to you wherever you are. Typically, that's looking like a home environment. So we bring a full preventive healthcare screening with instant results, without the wait, without the waiting room, into your home. And you have a complete visit from health screening to clinical consultation with a provider via telehealth in under an hour without leaving your living room. So we are working on something really, really important, which is prevention. It feels like there's sort of a preventive health revolution bubbling up right now, not only just within our small niche healthcare technology space, but globally, honestly, and definitely, in the United States. I think the statistics are scaring more people outside of healthcare now. 60% of adult Americans are walking around with at least one unknown underlying chronic condition. Each one of us probably has a story about how difficult our current healthcare system has been to navigate as a patient or a caretaker. And our entire mission is wrapped around the idea that we want to put more control into the hands of modern day healthcare consumers in the same way that Amazon Prime has done it for goods, in the same way that Netflix has done it for streaming. We are that solution for preventive healthcare.
I love it. Like, you're literally catching me right now. I was trying to do my blood work and I'm looking at my phone because, Get Labs, I swear they canceled on me 3 times. And I'm like, hey, maybe I'm going to use Repario for this one.
I think I need to just send you a kit and
send me a kit.
Take it for
I'm in. I want to kind of help tell one more quick story and then we'll get into some of the discussions around marketing. But I was impressed. Last year, you guys were at Health and I had a chance to connect with, is it Travis, your CEO?
Yeah, Travis Rush is our CEO and co-founder.
Yeah, so we did an interview with Travis, and during the interview, Travis said, hey, was it 200 tests at Health?
Oh gosh, I think you caught us in the beginning too. So we ended last year giving away 376 free comprehensive heart health, metabolic health, weight health screenings on the show floor. We're geared up to bring the same experience to Health this year. Yeah. So we'll be there.
Snap.
We're booth number 2824.
Okay.
We're right there, as we walk into the entrance, but we're bringing the same experience there. And again, it's all in the spirit of making sure that people know that access like this is even an option. The reason why we are out here talking about this and spreading the word is because awareness and people knowing that this is even an option for them as an individual or as an employee where their organization covers this as a benefit, or a member of a health plan that is going to start offering this as a fully covered benefit for you. You don't know what you don't know. So we're out here spreading the word, making sure that people are aware. That's the biggest part for us right now.
That's awesome, Kayla. So look, we've had a chance to work together at different companies, and I love kind of how you think as a marketing leader. in your point of view, what's a big misconception that people have about healthcare marketing?
Oh my goodness. We only have 20 minutes now. But I think my approach, especially recently, has gotten a lot of attention. I'm being more vocal and sharing my learnings online, which I think is really helpful for us in healthcare marketing, but B2B healthcare marketing in particular. I think that not even a misconception, but what happens a lot of times is that we forget this fundamental thing about marketing, and that's the psychology behind all of it. I have a psychology background.
Oh, cool.
I thought I was going to be a therapist when I grew up. I went to school, graduated with an undergrad with a psychology degree, was sick of being a poor college kid, so ended up falling into business development and marketing thereafter. But my background in psychology and behavioral health has really formed my strategic thinking around marketing. And I think a lot of times we forget as marketing professionals that our buyers don't actually wake up every morning thinking, I'm a B2B decision maker. They wake up checking Instagram, Facebook, scrolling TikTok, grabbing coffee, wrangling kids, feeling tired. That's who we're talking to, or who we should be talking to, not necessarily the role that they have at an organization or the job to be done. The best marketing, in my opinion, doesn't really sound like marketing. It sounds like real life. And in healthcare, there can be a really difficult balance to strike there, because healthcare has built its entire reputation on being clinically sound and reliable and grounded and rooted in data. And all of those things are still important as a marketer who's responsible for selling or marketing those types of services. But emotion before logic sometimes makes sense.
Amen.
Social belonging can play a role with your buyer. Loss aversion can play a role with your buyer. So that's kind of my pie in the sky philosophy around it. And I think a lot of times some of the misconceptions about healthcare marketing is that it's sterile, or it has to be sterile in order to be credible. And I'm sure you saw in my bio that I sent over, like, one of my biggest hills that I'll die on as a marketer and marketing leader is that fun and efficiency or impact can work together. Those two things can exist at the same time.
I love that. That's so great and well said, Kayla. And when we're forming our personas, as a takeaway here, don't be dry. Don't be boring.
Or think about what you like.
Yeah.
We're all human beings at the end of the day. Before we're the VP of marketing and communications, before we're a podcast host, before anything, we are all human beings at the end of the day.
Amen. So I say, add some of those things into that slide of your persona. We had publications like, what are they reading? Are they spending Becker's Health IT, Men's Health, or, Vogue? Where are they reading outside of work? Because that's a lot of what we could really be thinking about to touch people and connect with them, and how Kayla is chatting about. So Kayla, let's dig into campaigns, right? I'd love to take this idea and then talk about campaigns. Talk to us about a campaign, whether it's at Repario or elsewhere, that you're most proud of and why it mattered.
Something that I'm really proud of right now, to kind of open it up a little bit and not drill down into a specific campaign, has been the concept of trend jacking as a campaign strategy and using pop culture as a campaign delivery system. That's been something we've been doing recently within
Tell us more.
Yeah, the last 90 days. Pop culture fits into the human approach, right? Pop culture is shared language. It creates instant connection because people already have emotional associations with whatever pop culture moment you're attaching your brand to, right?
Yes.
And when you borrow from a pop culture moment, you're signaling, hey, we see you and the world that you live in. Like, we are the same people behind the brands, like, writing these messages to you. And it's not necessarily about chasing trends. It's about using relevance as empathy. Empathy is something that I think all of us need to be continuously working on, like building that muscle, because the only way you're going to break through the noise with a buyer is if they can feel an empathetic approach to what their problems are, their goals are, what they're struggling with day in and day out. And so some tactical things that we've done here to make those types of campaigns possible is we've created an agent within one of our AI tech stack components that is every single morning monitoring for pop culture trends that have popped off on different social media platforms the day before.
Yeah.
It lists out exactly how that trend has been adopted, what the through line could be to prevention. For example, if we're talking about Reperio, different ideas of how it could resonate with different members of our buying committee, for example. And then we have a Slack channel that we've created a Zap for that just automatically will blast those things out to me.
That's
and
cool.
gives me a really succinct way of distilling down all of the noise that is happening and figuring out if there's something that I can quickly get across the finish line. That, from a tactical perspective, is how we're operationalizing some of those things. Because you only have a moment, right?
Yeah.
With pop culture and trends, you have 2 seconds to make a decision on whether or not you're going to do something about it. And that's really helped us move with speed.
Love that. Any Taylor Swift in there? I know she just released
Oh my goodness.
her album.
Yeah. Taylor Swift actually kicked off.
I love Taylor Swift, by the way. She's just like incredible.
I mean, if nothing else, she's an incredible businesswoman, and
she definitely is.
She's an like a marketing honorable mention, you know. But yeah, she actually, you know, was something that we did in response to Taylor Swift sharing a story about her dad on the New Heights podcast that she went on with her fiance Travis Kelce, is really what drove the imagination or the creativity or the thought process around, hey, this is something that we could be doing more often. She was on that podcast, brought up this situation with her dad, who he had always been somebody that was doing his annual checkups and things, but then he missed out on them for a period of time. And then he wound up having a heart attack and in the hospital. And so again, prevention's universal. I feel like I might have it a little bit easy when I'm, you know, standing on my soapbox talking about attaching ourselves to pop culture moments, but pop culture is shared language. Prevention should be too.
That's awesome. I love that. And by the way, I also love how you're using tech to filter through the noise and get yourself signal that actually matters. Are your roots in PR? My
roots are not in PR.
Okay. You think like a PR person.
You know, we have an excellent PR consultant on board. His name's Brian. Shout out to Brian. He brings all of my wild ideas to life. And maybe the PR brain part of it just goes back to like being a human who is acutely aware of, like, when I'm scrolling through things, I'm like almost always looking at things through a marketing lens.
Yeah.
How do they think of that? Why are they positioning it that way? Oh, I love that ad copy. Oh, that design is really attractive. You should see my poor camera roll. I probably need to get 2 more iPhones at this point.
No, that's great. Thanks for that. Just curious about the background. Beyond what you had shared, I was wondering if there was a little PR there. So lots is changing. We got a lot going on in healthcare. We've got the one big, beautiful bill. So many things are shifting. What's a recent, maybe like a marketing trend or buzzword that you're tired of hearing? You could say something outside of AI, because everybody's kind of tired of that. And what do you want to see in its place instead of that?
That's a good question. I don't know if this is going to answer your question 100%. I think something I'm tired of hearing is that email is dead.
Oh my God. Yeah.
Some of the biggest, and exciting opportunities I've been able to either drive or influence from marketing into our pipeline at Reperio have been through email marketing. Again, it's all about the signals that you're chasing after and whether or not you're really listening and spending the time and the effort that it takes to be reaching the right people at the right time. You know, timing's everything. I think that applies just in real everyday life, but it definitely applies in marketing and sales. And If you're not thinking through all of those things thoughtfully, like, of course, yeah, any channel could potentially be dead if you let it die on the vine. But yeah, email marketing is not dead. It's very much alive and effective. That's a hill I'll also die on, I think.
Oh my gosh, I'm glad you went there because whenever somebody says that to me, I'm like, wow, okay, you are missing out. And so, and it's omni-channel, guys. Like you can't forget, like that could be first touch, second touch that leads to the other 7 touches that ultimately leads to the next thing. So I'm glad that you went there, Kayla. It's such an important tool in our toolkit. As you build out different campaigns and work with your team to execute on what you guys have to at Repario, what's a challenge that maybe let's make it about other healthcare marketers face that isn't being talked about enough?
I think something that might not be being talked about enough is, especially, and we're going to niche down a little bit, like specifically into B2B health tech marketing.
Okay.
Within the startup
Yeah,
space.
I love it.
We're typically a team of 1 or 2 behind the brand that is performing or chasing after a performance level of like an Amazon level organization. And so while we're sick and tired of hearing about AI, I've definitely gotten to the point where our jobs are not at risk because of AI, but you will get left in the dust as a marketer in particular if you aren't digging into these tools and learning them and adding them to your daily workflow. Like, talk about a string of buzzwords, but it's all extremely true. You know, the go-to-market engineer is a role that is starting to kind of explode in our space. And that's somebody who, in my mind, is like really building all of the agents that are going to support the onesie and twosie teams that are building these huge brands behind the scenes as just individual contributors. But I also think too, being able to like distill the noise that's happening, that's inbounding you as well. You know, there are so many tools that are coming out for marketers and sales that want to leverage AI. And it's being able to evaluate things and do little micro experiments in the spirit of moving fast and figuring out what's going to work. The most important thing to me that I feel like has really stood out is taste is what's going to separate you. We can use all of the tools, we can generate all of the things, we can 10x our productivity and output, but if you don't have taste, none of it is going to resonate. But yeah, you have to learn the tools. You have to ground yourself in all of the things that you've learned about being an effective marketer up until this point and continue to apply those in a way that you're training your support systems, which now happen to be AI, probably more than FTE headcount, still need to train them on taste. So the prompt engineering part of it, I think, is going to be a huge gap for marketers that are really able to like build these huge brands and the ones that aren't.
That's great, Kayla. Yeah, I love that you went there because the reality is teams are lean in our space and taste is key. Otherwise, I was talking about bland, but I love that you went with taste. It's the other side of it. And that unique fingerprint, that touch, the emotion, the connection is critical. Look, thank you so much. Really love where our conversation has taken us. One thing that we do here toward the end is actually share a question that came from a previous guest, but then allow you to leave a question for our next guest. So the question that I have from a previous guest is around channel partnerships and partnerships in general. How can marketers leverage channel partnerships, to your point, to leverage the leanness of their own organization?
That's a great question. Something that we've done has been creating co-marketing packages that every channel partner that we sign on, they have immediate access to those things. It's chock full of social media assets, email assets, canned language, prescriptive ways of how to communicate our offering to their clients. We can build these systems and things and make it so much easier on our channel partnerships to market for us. Our goal should be creating packages that turn people into evangelists for our product, our offering, our brand by making it really, really easy. again, you have to think about the person on the other side of the screen or the other side of the table. They probably are equally as busy as you are. And if you're going to make an ask for them, come with a solution that's going to make it super, super simple for them to deliver on.
That's brilliant, Kayla. I love that. Love that idea. Love the systemized approach, the turnkey way that you make working with you guys for your clients. What question would you leave the next health marketing executive guest with?
Something that we haven't really talked about here, but marketing at Repurio is in the trenches with sales when it comes to building pipeline, helping them close opportunities. There's a question that I posed on my LinkedIn profile not too long ago, and I can't remember the exact way that I phrased it, but maybe my question is going to be, if you think that a tighter relationship with your sales counterpart could move the needle for you today, for your business, what's one thing that you're going to do next week to make that happen?
Oh, I love that. You heard it here.
The marketing relationship, especially at our stage too, has this narrative of being misalignment, right? So if you're buying into that narrative, if that's happening at your company, what's one thing you're going to do next week to tighten that sales marketing relationship up?
Love that. Way to leave us with an awesome question, Kayla. Hey, look, thank you so much. Folks, stay tuned for our next episode where you could get an answer to Kayla's question. But what an awesome time here with Kayla Weeks, Vice President of Marketing and Communications at Repurio. I'm so excited that she joined us today. I'm so excited that you guys joined us today. Kayla, where can people get in touch with you to follow you? Sounds like you do a lot of posting and thought leadership. Where can they do that?
Yeah, follow me on LinkedIn. I'm definitely active. It's Kayla Weeks on LinkedIn. Follow Repurio Health on LinkedIn. We're doing super fun stuff. If you want to, see what human to human marketing can look in B2B health tech, come over, give us a follow along on what we're doing, and we're sure to have some fun.
Brilliant. Well, there you have it, folks. Check out the show notes where you can get in touch with Kayla and follow her work. Appreciate y'all tuning in to Healthcare Marketing Executive. We'll catch y'all on the next time. Thanks, Kayla.
Thank you.